I'm Dr. Bhargav Raut from Pathofast Lab in Pune. Patients often ask us what is the name of the test for male fertility, how to test for male fertility. The name of the test for male fertility is called the Male Infertility Profile or the Male Fertility Panel. This includes a series of blood tests to check your fertility hormones. It also includes the Semen-Analysis Test, which is also called the Sperm test. So this is a panel or a group of different tests that are done to check your fertility. In some labs and in some clinics, a male fertility test only includes the sperm test or the semen test. So sometimes when a doctor will say fertility test for a man, he will mean that he only wants you to do the sperm test or the semen test. But in most places, a male fertility test will include blood tests for hormones and many things, as well as the sperm test and the semen test. And now I'm going to explain all these to you. Now, what does this male fertility test actually check? Well, the first thing that it checks through the blood tests are whether your brain is making the right amounts of the fertility hormones that are necessary for your fertility. These are made by the brain, and this is something that we check from the blood tests. The next thing it checks through the semen test or the sperm count test is whether your sperms are normal, whether their number is normal, whether their movement is normal. The next thing that we check through the blood tests is whether your sugar and your cholesterol levels are normal, because high sugar and cholesterol negatively affects your fertility. The next thing we check is, do you have any STD which may be actually blocking your sperms from reaching out? This is again done through the blood tests. So what is the list of tests that are included in the male fertility test? The first is always the sperm test or the semen test, or it is also called the HSA test, human sperm analysis. The next are the STD tests, which includes usually chlamydia and gonorrhea, because they can affect your fertility. The next is the test for sugar and your weight, which is the HbA1c and the cholesterol or the lipid profile. And then we have the long list of hormones, which include the FSH, the LH, the testosterone and the prolactin test. The FSH and LH are important for your fertility. They are important for your sperms to be produced and made, and they are also important for your testosterone to be produced. The testosterone test itself is necessary for your manly characteristics, and the prolactin test is done to make sure that your prolactin level is not too high, because that can negatively impact your fertility. So what do we check in the sperm test or the semen test? We basically want to make sure that your sperm count is normal, that your sperms are moving normally, and that the percentage of live sperms is adequate. So the sperm count normally should be around 39 million. In a sample of your ejaculate, we expect at least 39 million sperms. Secondly, we want at least around 60% of those sperms to be live, because a proportion of the sperms is already dead. So we need at least 60% of them to be live, and we want that at least 40% of those sperms are moving fast, because only motile sperms are capable of joining with the egg and allowing you to conceive. So this is what we check in the sperm test. Then why are the blood tests done? What do we check in the blood tests? So we check whether the hormones which are necessary for fertility are being made by your brain in adequate quantities. In this is the FSH test and the LH test. Both these are important for manufacturing your sperms and also for creating enough testosterone. So these are made by the brain, and if their levels are below normal, it means they are not being made enough, and so then your doctor can treat you for that. Next thing we want to check is whether your testicles are actually working properly. Even if the hormones in your brain are being made in the right amount, if your testicles don't respond to that, they will still not make the sperms. So we can check for that also by checking these hormone levels. I've included a list of the hormones here as well as their normal ranges. This test is a blood test, and you should just provide a single blood sample in the morning, and that's enough. You don't have to do any special preparation. You usually don't even need to be fasting for this. The next important blood tests are the tests to check your sugar and whether your cholesterol is normal. Having a higher than normal sugar or being overweight are signs of something called insulin resistance, which is the earlier step of diabetes. This has a negative effect on your fertility. People who are overweight and obese are generally not able to conceive as well as those who are fit. And these two tests check for that. I've included their normal ranges. Again, these tests can be done in the same blood sample that you provide for the hormonal test. You don't have to provide a separate sample, but you do need to be fasting for these tests, and you should provide the sample in the morning. The last important group of tests are the STD tests. These include the Chlamydia PCR test and the Gonorrhea PCR test. These are basically sexually transmitted diseases which go inside your body, and they cause a blockage in the tract which goes from your sperm, from your testicles outside. So you can understand that if there's a blockage somewhere in that path, your sperms will not reach out. Not only that, they can also directly damage your testicles, and they can also produce a swelling of the entire urinary tract, and this can obviously impact your chances of fertility. Not only this, but you could also land up spreading this to your partner. So it's important to get these tests done. These tests are done on a urine sample, and you have to provide just a single urine sample, and they directly check for the DNA of these organisms, so it's very accurate, and you will get the result within 2 to 3 days.